Your minds are wandering. Okay, yeah, but raise your hand, please. Be honest. Yeah? I'm sure most of you are wandering right now. Your mind's going off. What's he talking about? Oh, what do I have next? Or I didn't get my meal. Or, that tasted good for lunch. Or, all these things about the future, the past. Oh, I shouldn't have said that to my boyfriend. Yeah, that's what's going on probably in most of us right now. Yeah? We're a little bit wandering. Okay? When we wander, we're not in the present, by definition. We're in the future or the past. Okay? To be able to relax deeply, we can settle in the present. Babies, young kids are in the present. You watch them, they see something and they kind of look like this. Totally absorbed, right? A baby or a young child. So to be childlike sometimes, in the sense of settling and just being present, it's very healing. It's very healing. We, live very stressful lives, particularly as medical students, very stressful. Okay? And sometimes we suffer because of that. We can get physical illnesses, we can get mental illnesses, we can suffer from anxiety, fear, sadness, depression, etc. All of us taste this. Okay? Sometimes settling, being in the present, can, at least temporarily, give us some relief, kind of a refuge. Okay? Now, on top of that is compassion. Okay? Compassion just basically means, the simple way to understand compassion is concern for others. Concern for others, a warm heart. Okay? Too much of the time we get caught up with me, me, me. What do I need now? 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 Me, me, me. Okay? When we're in that mode of me, 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 it's rather narrow. How does it feel? We're all in that a lot of the time. Right? All of us. Okay? It feels rather constricted. The heart doesn't feel very open. We don't feel very relaxed inside. The me, me, me stuff actually brings more anxiety and worry, sometimes fear, sometimes sadness and depression. Okay? The more we can at least think about someone else who may be having some difficulties, at least for that moment, we are away from the me, me, me stuff. Okay? And then when we can actually do something, these are wonderful times to help somebody. And helping somebody doesn't have to be, building the Golden Gate Bridge, like a Hong Kong bridge to Llama Island. Not that we want that. It can be something very simple, like a smile. When you walk in to see a patient, they're hurting. That's why they are a patient. Physical disease, often a mental overlay with that. Fear, anxiety, maybe depression. Okay. A smile goes a long way. Doesn't take much of your time. Okay. Looking them in the eyes and saying, "Good morning," takes a few seconds. It goes a long way. Physical contact, culturally appropriate. It might be a shake, it might be a hand on the shoulder, if appropriate. Okay? Can go a long way. These are simple but very, very important things. Looking directly in the eyes of the so-called patient, the person that's there to see you. Very important. Very important. They feel recognized. Okay? Because trust is a very important ingredient in healing. Trust. How do you develop trust? Trust is based on respect. Okay? Not only respecting the other person, but respecting yourself. Having healthy self-confidence. And I'll come back to that point in a moment. Healthy self-confidence. Okay? Then how do we develop respect? Respect comes from honesty. Honesty is really the key. We talked about that before. If we're not honest, Then we have kind of a foundation in sand. You know, the tide comes in, foundation gone. Everything built on top of that gone. Okay? It's really our ethical compass, honesty. Very, very important. Simple truisms, but very, very important. Because from that develops respect, and from that develops trust. And from trust can develop real concern, compassion, love, altruism. I mentioned at lunch some now old studies, very good research. It's been replicated a number of times and it's accepted. It's 20 years old. Women with breast cancer, they divided into two groups. Both groups of women got the standard treatment depending on their stage and type of breast cancer. So it included surgery, either mastectomy or lumpectomy, a more conservative surgery, or radiation chemotherapy, whatever was appropriate for that woman's breast cancer. Both groups got the same. One group got TLC, tender loving care. They sent a psychologist around to these women regularly who just flooded them with love. And it turns out that on life satisfaction reports, you know, they have to fill out a questionnaire. Of course, as you'd expect, the women that received additionally the tender loving care, they had higher scores on their life satisfaction. Okay? The thing that turned out very interesting was the women that received the love, they lived longer. It's been replicated, large studies, double-blinded, randomized double-blinded studies, peer-reviewed journals, best journals, yeah? Many times replicated. This is true. Okay. We don't know how this works. There's a lot of interest now since then, and you know, in the immune system. Now there's been a lot of work looking at IL-6, cortisol levels, and different measures of stress in the immune system, okay, with positive mental states. And much research has been borne out that positive mental states, including meditation, okay, enhance our immune system. So our immune system obviously is very important in fighting disease, even cancer. Okay? So these things are not only fluffy science, some people might say, okay, but they're also making their ways into mainstream science. And those of you that are beginning your 6-year career as a medical student, by the time you get more senior, you'll be exposed to some of this research. It's growing exponentially. Okay? Very, very important. Okay. May I shift gears for a moment? Okay. I want to mention something that we talked about also at lunch, is Medicine Buddha. I know you're not all Buddhists, so don't worry. But I just want to mention Medicine Buddha. Okay? Medicine Buddha is the healing aspect of the Buddha, okay? Blue in color. And when I go to medical schools in Buddhist countries, like Mongolia, certain Buddhist federations within the Russian Republic, excuse me. I mentioned Medicine Buddha. And the students, when I come back the next year, they're very excited about this. They want to know more. And often they want to learn to practice. I'm not going to teach it to you. That's not what I'm doing here today. But what I want to mention to you is that I'm convinced as a scientist, as a medical scientist, health scientist, I'm convinced that my practice for nearly 30 years of Medicine Buddha has enhanced. Excuse me. Getting over the tail of a cold that's been there for a couple of months, bad flu, has enhanced my abilities as a doctor. I'm convinced. I don't know how, but I've observed this. I should say I've observed this. I just want to mention that to you. I wanted to mention that the art of healing, okay, your dean says the art of quiet, the quiet art Your dean, who I met at lunch, who's an amazing man, Dean Lee, S.P. Lee, is quite an amazing man, a very accomplished hepatologist, who actually spent 23 years, you may know, at the University of Washington, which is where I was for a much shorter time, and had an endowed chair and had many, many great awards for his research and his work in hepatology. He said, he called medicine practicing the quiet art, suggesting that healing is more than giving a medicine. It's more than operating, okay? It's, in fact, much more. It's much more. The more we can be human, be honest, have some compassion, not look down and judge negatively the person in front of us, our patient, the better the chances of trust in that relationship and hence healing, regardless of the medicines or surgery. Of course medicines and surgery are required, of course. I'm not saying they're not. But if you add that TLC, like with the breast cancer women, you get much better outcomes and the patients feel better. And you feel better. This is very important. You know about burnout. Some of your friends or you may be experiencing it, burnout. This is something, unfortunately, that our profession is plagued with.